Okay, so there are four muscles that are involved in the rotator cuff. They are the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. And then there's the three bones that they insert and originate on, and they are the scapula, the clavicle, and some of the bone, which would be the humerus. So when it comes to, well, everybody is an individual. So you have three types of clavicles. So we've got the flat. So we're looking at the actual acromion. And then we have the curved and the hooked. So when we're talking about a tear in the supraspinatus, the most common clavicle type is the hooked one, because the tendon of the insertion of the supraspinatus muscle runs underneath the clavicle. When you're doing a lot of movement in your shoulder, it's hooking into the tendon and it's rubbing and it's causing the tear to begin. Okay, so the etiology of the injury. There are two types. So there's the macro trauma and the micro trauma. The macro trauma is a not very regular injury, and it normally happens in athletes under the age of 40. So it happens in high contact sports like AFL and in rugby, American football, when they're using like up. So I'm guessing, so in like ruck knocks in AFL, so that arms up in the air, and then getting collided with and the tear occurring. And then there's the micro trauma. So that is a repetitive overuse injury. It happens a lot in athletes that are over the age of 40. Because in sports like swimming, cricket and baseball, so once again, it's continually using those arm muscles and the continually rubbing against the clavicle, which causes the tear. Okay, so signs and symptoms. There are no obvious signs to a tear. So you just have to go on the symptoms that are occurring. So often it's pain in your shoulder. It normally happens on the anterior, superior, lateral areas of the shoulder. During abduction and rotation, you'll have weakness and you'll feel that something's not feeling so good. When you're palpating the area, there'll be tenderness. And if it's a complete tear, then there'll be pain when you're at rest, so sleeping or just sitting at the couch or whatever.
Alright, good afternoon to my esteemed tutor, Mr. Harry Benyak, and my fellow classmates. Right, my name is Zul, and I'm going to be presenting the last three slides: early management, prevention, and protective equipment, and also the conclusion. Right, early management. What is the action you should take upon having encountered the injury? Right. First up, you always, in any form of injury, you always want to recover back your function. Right? Normal function and biomechanics. In short, it just means your range of motion and your normal natural functions. Alright, and for the second point, especially in the elderly, you want them to be able to regain their functional abilities because their bodies are generally weaker and they tend to have more difficulty in adapting biomechanically to injuries. So, non-operative program. First up, you always want to immobilize the injury. Make sure you don't aggravate the injury. You apply ice, heat, or ultrasound treatment. You can use ice packs, or you can use those cold gels to place on top of your shoulder muscles, on top of your back muscles. And I don't know, for some strange reason, this is one of the few injuries I've encountered which also uses heat and ultrasound treatment in addition to the ice packs. Right? I'm guessing heat is to generate blood flow so you can have faster recovery, and ultrasound treatment in some ways also to stimulate blood flow and generate heat internally because this is a deep tissue injury. You can have non-steroidal anti-inflammatory drugs, NSAIDs. Examples of NSAIDs include ibuprofen, aspirin, Panadol, things like that. you can also have corticosteroid injections. First up, I've been through a course of NSAIDs myself for about 2 years. While they are very good, very effective, I was specifically on ibuprofen. It's very effective, it takes place within minutes, the pain is totally gone. But then again, the thing that you have to be wary about using NSAIDs is that your body will tend to develop dependency on the drug. So you have to watch out on that, on the dosage that you consume. Make sure you don't develop dependency, otherwise the effectiveness will take from minutes to hours. And corticosteroid injections, you have to be aware that anything more than 5 dosages is bad, because it causes tendon atrophy and also causes poor tissue quality. You don't want that. Alright, prevention and protective equipment. We generally have a two-pronged approach, right? First, we try to alter our normal movements in order to avoid impingement, and also improve execution techniques. We can try to move in a different way and execute your actions in a way similar to the actual action that you normally do, but slightly different. Case in point, let's say if you do swimming exercises and you have a rotator cuff injury, if you have been doing normal strokes, you probably want to alter it to breaststrokes, or what do you call this? Breaststrokes, right. So this is breaststroke. Sorry, I'm not swimming. And then for active protection, what you want to do is to have muscle strengthening, right? You want to strengthen the surrounding muscles, the subscapularis and so on and so forth. Specifically, internal rotation, external rotation, and adduction, because these are the muscles which do not stress your supraspinatus as much. No slings are recommended, alright? Basically, you don't, when you immobilize it, you don't want them to be wearing a sling, because it can cause, what is the word, adhesive capsulitis. Adhesive capsulitis is just a technical term for having your general connective tissue in the shoulder girdle inflamed. In layman's terms, it's called frozen shoulder. Preventive equipment, protective equipment. We didn't manage to find anything which manages to protect the muscles. So I would suggest that you have two, your ears and your brains. Listen to the advice of your medical professionals, and brains, make use of some common sense. Do not aggravate your injury. I'm sure everyone has that. Yeah. So, in conclusion, alright, that doesn't sound right. In conclusion, pretty much all we said and then some. Right, supraspinatus, of all the muscles in the rotator cuff, that's the most susceptible to tearing. Can cause by microtrauma, impact, or repetitive movements like swinging your tennis racket, so on and so forth. As with all injuries, signs and symptoms include pain, weakness, limited range of motion. I think everyone pretty much knows that. Early management includes immobilization, NSAIDs, corticosteroid injections, as you all know. Subsequent treatments, if you have gone through the early part of progression, you might be able to go through progressive loading of the muscles to build up back to strength. If you strengthen the surrounding muscles, it does help to prevent future recurrence of the injuries. Alright, any questions? No questions, thanks very much.
Alright guys.
How would you mobilize the injury if you can't use a sling?
No, the sling is for the long term. For the immediate occurrence of the injury, you do use the sling. But you don't, let's say you're out for 3 months, you don't have the sling on for 3 months, because that will cause inflammation. But obviously, upon occurrence of the injury, you do immobilize it by using a sling.
Probably also use taping, but it's probably best just not to be doing those movements, obviously, because then you're just going to make the tear worse and make it into a complete fracture, complete tear. Sorry. How long would you be out for with an injury like that until it stops hurting?
Yeah, and that's a very good question which deserves an answer.
Thank you.
Pretty much depends on your
Recovery rate.
recovery rate. Is that good?
I've got just 2 quick questions. You mentioned shoulder impingement. What is impingement?
Impingement is basically how do I say, when you
When it gets caught.
encroach on other, that's the word, get caught on, it gets caught with the other.
Yeah, what gets caught?
It's when the tendon gets caught in between the scapula, I believe, and like in between the
It's like pinching.
It's when it pinches and
It's the nerve.
Nerve, that's it. Okay.
Pinch. Yeah. So it's really common in the shoulder and the bicep screw.
Bloody painful.
I've had it for you. You mentioned that you use ice, heat and ultrasound in conjunction with each other. Would you recommend that
I would
immediately after the injury?
No.
Or
I
you
would
use
recommend ice first.
Yep.
Immediate icing to numb the pain and also to how do you say? Basically the whole idea is to ice it, reduce the swelling, and once, let's say after 3 days or depending on the condition, then you start applying heat treatments and ultrasound in order to get blood moving. But of course, all this occurs after the swelling has gone down.
Yeah.
Right.
Okay, that's good. Yeah. That's what I was looking to say, okay? So you don't use them immediately after the injury because obviously it's counterproductive. But ideally what you want is to decrease the temperature around there, and then you can have other devices like TENS, electromagnetic devices that can increase the mechanical stimulus to promote fibroblast proliferation and that sort of thing. So, alright, well done guys.